Hello, I'm Dr. Hilary Jones, a GP, a TV broadcaster and someone who's suffered from back pain myself in the past. What types of medication are there for low back pain and what could you expect to be put on if you're a sufferer? Well, most doctors would probably start you on something mild, maybe a non-opioid painkiller, depending on the level of the symptoms that you have. If that isn't sufficient, it's logical that you'd go on to the next step, which would be a weak opioid, and then, if necessary, a stronger opioid. And that begs the question, what should you ask your doctor about your medication? Well, first of all, ask your doctor, how often should you take your treatment and when? Is it best to take it at night or is it best to take it in the morning, for example? Of course, ask about any likely side effects. It's best to be prepared. And of course, there are likely to be side effects the stronger the medication that you take. If you do get side effects, of course, go back to your GP and tell him about them so that, if necessary, any adjustment to your medication can be made. It's also worth asking whether the medication interferes with anything you're already taking, whether you can drink alcohol with it, for example, as well. And then it's all about balance. If you're on a mild painkiller, it may not be enough to control your pain. If you're on something very strong, it may be that you're more likely to have side effects. Now, you don't want either. You want something in between. So, as I say, it's all about balance. Taking your medication, of course, isn't the only way to decrease your pain. You could also think about using a structured and tailored exercise program that is recommended by NICE, the National Institute for Clinical Excellence. You can get a head start by using the Pain and Simple movement videos and incorporating that into your tailored program. And it will be very helpful to do that with the help of your GP, who knows you best.